Liposculpture is a surgical treatment, although there are some clinics who are claiming that it is a minimally invasive treatment. But if we can respect liposculpture as a procedure, it is a surgical treatment which can be performed under local anesthesia with sedation or general anesthesia. In our clinic, we have got both local and local anesthesia with sedation. Liposculpture is a process where we are actually carving the body, taking the fat out from certain areas, and occasionally we actually add fat to certain areas which enhance the body's features. So essentially sculpting the body, that is liposculpture. Liposuction started becoming popular in the mid-80s or probably even early 90s. In those days, the principle of liposuction was where you take as much fat as you can with a cannula. Some of the cannulas in those days were anything between 10 to 15 millimeters. Nowadays, the cannulas are much finer. We also use an energy-assisted liposuction, which is liposculpture. We use radiofrequency, we use ultrasound or laser, sometimes even water to break the fat up, and that way we can use smaller cannulas to suck the fat out and sculpt the body essentially. Liposculpture can be used for various things. I'll give you an example. Some of the younger people will have a little bit of fat collection under this area. Medically, we call it a submental collection of fat. Even small areas like jowls or sides of the jaw. You can carve those areas and give a much better profile of the jawline. Smaller areas like say underarms, if there is not much skin laxity, that means some people call it bingo wings and other things, but laxity of the skin whereby there is small amount of fat but the skin is reasonably good, you can take that fat out and make the arm look much better. Smaller areas like say saddlebags or even lower abdomen, the collection of fat that ladies get after childbirth. On the other hand, there will be some people with a moderate amount of fat, and you have to assess the quality of the skin. Each and every operation is balanced against what the patient will benefit for and of course what the complications and side effects can be. It is a question quite often patients will ask, and the answer is simple: as long as you want to maintain it. Think of it as like having a hedge in your garden. If you do the hedge, trim it down, and then after some time you have to trim it back again. Similarly with fat, you collect a bit of fat, we take it out, carve it, make it look good, and then if you don't diet, exercise and maintain that, it will come back. Because body can always gain or lose fat. But one thing is certain, that if you take that fat out, those cells, the fat cells that you've taken out, they'll never come back, and that area will have a slightly less tendency to recreate the fat. But in short, if you eat the wrong kind of food, don't do exercise, some of the fat can come back and even more. Of course, the answer is how much you can safely remove first. Second, how much does the patient need to be removed? And the most important thing is if you remove too much, you can get excess skin hanging, and so there is the balance. Do you do a second procedure to take some more skin out and make it look better? Or do you do a moderate amount of fat removal and make the patient feel better? I think the answer is what the patient would like to achieve. It's all about the patient. We are here to give the patient the best possible results, but sometimes the patient's expectations are slightly higher, and we need to make sure that the patient understands what as doctors we can deliver. Liposuction or liposculpture essentially does not primarily make you lose weight, because think about it, the fat we are removing is only from a small area. We can remove up to 3 to 4 liters of fat. Probably this answers your last question much more clearly. Up to 3 to 4 liters of fat can be removed safely. Beyond that, you can remove, we have done up to 7 or 8 liters of fat, but then you need to do fluid replacement, etc. But weight-wise, I think the patient will lose anything between 1 kilo or 2, but that is not what the patient wants to hear. What I tell my patients, I'm going to give you better shape. I think you'll look better with your clothes and you'll have a much better profile, rather than give the patient an idea that they're going to lose weight. Some of the effects you'll see fairly quickly. Although there's some swelling there, some redness there, you've got the corset on, but from day 2 or 3, when the fluid has come out, body has absorbed the fluid, and you're starting to see the difference, you'll start to feel more confident. But the final results always 6 to 8 weeks, because that is when the skin tightens up, the skin starts to settle down, and the body molds into the shape that we have created. The procedure itself is only painful because when we put the local anesthetic in and the patient is awake sometimes, they'll feel the local anesthetic, which is a bit of a sting, sometimes even uncomfortable. But when the procedure is being done, it is not, as far as I know, I have never had it, so I can't tell you from personal experience, but it is not painful. Every treatment that we do, from non-surgical, surgical, or minimally invasive, have side effects. If somebody is selling the treatment as nothing else happens and he'll be fine, then the patient gets a wrong idea. Some of the simple things like bruising, swelling, they're common. To prevent infection, we give prophylactic antibiotics, and that's quite safe. But sometimes you can get a little bit of oozing of blood, hematoma, which is collection of blood. Sometimes you can get seroma, and there are other major side effects, but they're far and few between. Our audit figures show that our simple complication rate is below 4 to 5%. But the major complication, like anybody else, we will get it once in a while, but they're really, really rare. But the patient needs to be made aware of all those before the treatment, and then the patient can have a much better outcome, because their expectations are exactly what you can deliver.